Good morning, McGraw, and it has nothing to do with me not liking you guys or love you guys. I'm just in a different city in Kansas City now.
All right, fair enough. Now, you have been looking at some Missouri health insurance premiums for 2018. What are you seeing?
Well, premiums are still going up. We're looking at 20 to 30% increases in the state, unfortunately. I mean, that follows a trend of, I guess, the last 5 or 6 years of pretty consistent premium increases in the individual market. I think it really drives home the point that we really do need reform, not only at the federal level, but also at the state level when it comes to health care. And, whether you're talking about the federal law, I think the Cassidy-Graham bill that has been really talked about, we don't know if that's going to go forward, but one thing it would do is it would allow for greater flexibility at the state level to actually provide insurance or provide at least the environment for insurance in a way that actually is tailored to those respective states. And like you said, the insurance market here in the state continues to face problems. And like I said, those rates continue to rise. I think we really do need to see reform sooner rather than later.
No one argues that insurance rates are going up, deductibles are going up, and they've been going up, and it's really been a sort of a rocket ship over the last 20 years, not just the last 5. But Show Me Institute being a market-based think tank, right? You're a free market-based think tank. When you can't really put, or it's very difficult to put free market ideas into health insurance, because if I have a drug, say an EpiPen, and I choose to charge $600 for the EpiPen, I'm maligned for it, which you should be allowed to charge anything you want for a drug, right? If you have insurance, you get charged one type of price for the doctor. If you don't have insurance, you get charged another price of insurance. And then if you're in a car accident and you rush to the emergency room, you don't say, "Oh, wait a minute, I don't really want that I can't afford that one. I want this one." So really, when you talk about market forces when it comes to health insurance, the whole system's haywire because that's not the way it's set up.
Well, I mean, you're exactly right that it's haywire. I would kind of dispute whether we're really in a market-based system. And a lot of this goes back, like you said, it hasn't just been 5 years. It hasn't even just been 20 years. It's been all the way back to the 1940s where the government actually stepped in and started incentivizing employer-based insurance. And so slowly we started being separated from the cost of our insurance and away from the cost of our care. Over time, that creates this really difficult feedback mechanism where you don't necessarily see the prices, and so you can't necessarily even see, whether you're getting value for what you're actually paying. And so increasingly, salary is becoming kind of deferred into insurance and those benefits as well. And so you're exactly right. If you want to see reform, you really do want to move away from a, quote, insurance system because what we're seeing now in health insurance isn't really insurance necessarily. It really is a maintenance plan. And, your homeowner's insurance doesn't pay for your grass you cut typically. Your car owner's insurance doesn't necessarily pay to have your oil changed. It pays for catastrophic events in both cases by and large. And I think that is one of the things that when we look at health insurance, exactly, when you're talking about running to the emergency room, that's where insurance should actually play a role because you really don't have an option to kind of decide where you want to go and be able to plan for that price-wise or otherwise. But when you're talking about just what really drives the cost of insurance, it really is the little stuff all along the way that builds up, and that cost gets passed on to everybody.
What happens, though, and this is a sort of philosophical question, what happens when you don't have insurance and you get cancer, right? You get really bad medical service at an exorbitant price. So there is, right, if I don't have homeowners insurance and my house burns down, I'm out of luck, right? But if I get cancer and I don't have insurance, the system is there to help you, and those costs are then passed on to those of us who have insurance. So again, there's no deterrent not to have insurance.
Yeah, and what I would suggest isn't that we remove the backstop to protect our most vulnerable people. If you are in a tough situation, you really have no other options. I have no problem with having a system in place to protect those sorts of folks. But the issue that really drives costs isn't necessarily folks, going down that road, not having insurance, and then that being the complete driver of our cost problem today. It really is everybody's little choices kind of over time where, for instance, if you have health insurance and you don't use it that often, there is kind of this incentive, this feeling that when you do use it, you want to use it all up. The problem is that even if you spend all the way up to your deductible and try to get the insurance company to spend more and more money on top of that, that is not cost-free. That cost is passed on to everybody else. And so it creates this really weird system where you really want to use insurance, but under most circumstances, most people don't want to have to use insurance for the house or for the car. They would just rather kind of be whole. But the problem with insurance in the health sphere is that you end up getting stuck with a bad product too often that under the current system, a lot of us are forced to pay for, whereas in other systems you can shop around and you can try to get value short-term and long-term from it. And like you said, you're exactly right. If you have cancer and you don't have insurance, you're in a rough spot. But I think that you can have a backstop for those exceptions to the rule and make sure that folks, by and large, are able to find affordable health insurance just to meet their normal needs.
You see here, but in this new Graham Casualty bill, which will do away with the individual mandate, which says you're not being forced to buy insurance. So the day after you're diagnosed with cancer, you can buy insurance. That's not the way insurance works, right? Or these skinny plans where they say, only have limited options, right? Or men shouldn't have to buy pregnancy insurance. Well, men, I think, should buy pregnancy insurance because men can get women pregnant up until the day they're dead. Women should be the ones who shouldn't be forced to pay for pregnancy. But the point is this: if I don't have pregnancy insurance and I get a woman pregnant, right, then I buy pregnancy insurance. That's not the way insurance works. That's like buying fire insurance the day after my house burns down. It's just not going to work.
Well, I mean, I think you're exactly right, but that goes to it not being actual insurance. That is a maintenance plan. And that is why when we're talking about insurance, we really have to kind of reframe it in our minds, because when we talk about cars or houses or a lot of other things that we would insure, we recognize that those are for more or less catastrophic events. And yet when we talk about health insurance, it's a very different kind of thing. And the other thing with particularly individual mandates, by and large, it's been pretty ineffective. That's part of the reason why the cost of insurance has continued to climb in the individual market, is because young, healthy people are looking at the cost of what they'd be paying for, it'd usually be, a car payment or two every single month. And these are folks that don't necessarily have a whole lot of money, so they have wagered and said, you know what, I'm going to just go without insurance, not pay into this pool. And when they don't pay into this pool, it means that the folks who remain in the pool, who are generally older or sicker, end up paying more anyway.
Yeah, but Patrick, I got to run. But you know what's interesting is that all the young kids pay their cell phone bills. You know why? Because if they don't pay their cell phone bills, their cell phone will be turned off.
But in cell phones, they get to choose their cell phone plan, and they have actual competition. I don't know of a cell phone plan, and correct me if I'm wrong, that charges you $400 a month for no service. And that's effectively what those folks are caught with in the individual insurance market.
We are great at exposing all the problems, but we are short on answers.
Well, I've got some answers at showmeinstitute.org, but absolutely. I think that for too long we've had a really long discussion about, wanting to guarantee services, but we haven't really talked about the trade-off and talked about what we really want to do. And the only way that you can really guarantee service is by getting the cost of care down. The only way you can get the cost of care down is through the free market.
That's Patrick Ishmael. You have more to read at Show Me Institute?
Yeah, absolutely. We have a paper on Medicaid, and we have a paper on DPC as well, direct primary care.
And that's showmeinstitute.org?
Yes, it is.
Patrick, have a good day. Thanks. 840